Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a condition that nearly everyone experiences at some point in their life, but for some, it becomes a long term struggle: insomnia. Poor sleep doesn't just make you tired, it can affect your mood, your memory, your physical health, and even life expectancy. To guide us through the causes, treatments, and new possibilities, I'm joined by my friend and colleague, Dr. Bryn Henderson, a board certified physician and leader in regenerative medicine. Dr. Henderson, thank you for being here.
Thank you.
Let's start at the beginning. What is insomnia?
Insomnia is a sleep disorder where people have trouble falling asleep, staying asleep, or waking up refreshed, and sometimes waking up too early and not being able to even get back to sleep. Insomnia can be transient, a few nights, short term, lasting a few months, or chronic, lasting more than 3 nights a week for 3 months or more. When it happens most nights or weeks, it can significantly interfere with your daily life.
So, does genetics play a role in this?
Absolutely, yes. Insomnia runs in families. Certain inherited traits can influence how the brain regulates the sleep wake cycles, making some people more prone to sleep, especially when combined with stress and medical conditions or lifestyle factors.
Let's talk about early development affecting insomnia.
Well, the brain structures and hormone systems that control sleep begin forming in the womb. Differences in how these systems develop may affect how a person's body manages sleep, pressure, and circadian rhythm later in life.
Okay, for those who may not know, what is circadian rhythm?
Oh, it's essentially your body's clock, your 24-hour clock. It tells you when you feel awake and when you feel sleepy. It even affects things like your appetite, body temperature, and mood. Light is the main signal that sets up our clock. Bright light in the morning helps you wake up, and darkness at night helps your body produce more melatonin so you can fall asleep. When the rhythm is disrupted by things like late night screen time or shift work or jet lag, sleep quality and overall health can suffer.
So, could you tell us what the main causes of insomnia are?
The causes of insomnia range from stress, anxiety, and depression to chronic pain, certain medications, and poor sleep habits. Lifestyle factors like irregular sleep schedules, heavy caffeine use, and excessive screen time before bed also play a huge role.
How do you diagnose insomnia at your clinic?
Diagnosis is based on a patient's sleep history and symptoms. It's important to listen. In some cases, we may use a sleep diary or even an overnight sleep study to rule out other conditions like sleep apnea or restless leg syndrome.
All right, then let's talk about treatment. What works best?
The first line of treatment is often cognitive behavior for insomnia. It helps change unhelpful thoughts and behaviors around sleep. Good sleep hygiene, like keeping a consistent schedule, creating a restful bedroom environment, is essential. For short term relief, some patients use medications, but these are generally limited to avoid dependency.
Let's talk about traditional Chinese medicine. What do they do for people with insomnia?
Yeah, that's a good question. The traditional Chinese medicine, of course, has been around for thousands of years, and insomnia may be linked to imbalances in heart, liver, or spleen. The herbal formulas they use calm the mind and nourish the heart. Acupuncture also is used because there's points that are often used to promote relaxation and restore balance to the body's energy flow.
Well, now let's get to regenerative medicine, where you're the forefront. What regenerative medicine have you discovered works best for people who are insomniacs?
Well, regenerative cells and exosomes are being studied for their potential to reduce inflammation in the brain and support healthy nerve communication, which may help regulate sleep patterns. Certain peptides are very powerful, like the delta sleep-inducing peptide, which also helps improve sleep quality and duration. And then there's neurofeedback, a type of brain training that uses real-time electroencephalograms to help the brain shift into patterns associated with relaxation and restorative sleep. It's not invasive, it's medication-free, and it's showing promises of very supportive therapy for chronic insomnia.
All right. I'm very interested in what you said about delta sleep inducing peptide. Does that only come in an IV or can someone take it as a supplement?
It does not come in supplements. DSIP is used as an injection. It can be a nasal inhaler.
So they can do it at home.
Yes, absolutely.
And you have it available?
Yes, ma'am.
That sounds fascinating.
That's in the office.
Well, I encourage everyone to come to his office then if you can't sleep at night and you've given up on your melatonin. This is the way to go.
Yeah, what we do day to day to improve their sleep is to keep a regular bedtime and awake time, even on weekends. Limit the caffeine after midday and reduce screen exposure before bed. Create a cool, dark, and quiet sleep environment. Regular physical activity during the day can also improve sleep quality at night.
All right, so someone's an insomniac. What's their outlook for the future?
Oh, they need a combination of strategies. Most people see significant improvement just by addressing both the causes and their habits. Their lifestyle helps to maintain a healthy sleep habit.
All right, let's do your mnemonic for insomnia.
So the mnemonic is REST, rest.
And R stands for?
Regular sleep schedule.
E.
Environment that promotes rest.
S.
Stress management.
T.
Therapy such as neurofeedback for lasting change.
Thank you, Dr. Henderson, for walking us through insomnia and its many causes and treatments. Quality sleep is vital for overall health, as everyone knows, and help is available for those struggling. Today, you heard some of the regenerative therapies that are now available in Dr. Henderson's office for restoring good sleep, transforming your health and well-being. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.